Good evening, doctors. Hoping all are well. After a long time, the session we are conducting, long clinical consultation mock session. So today our priority base, the candidate first, Dr. Aishwarya Jasi is here.
Yes, I'm here.
Okay. We'll have more session inshallah in future. So according to the priority list who are missing today, no need to be worried. Inshallah, for dietary candidates, so we'll have more session according to the scenario base. So Dr. Aishwarya, so your first clinical consultation case, it is in our long clinical case, it is around 15 minutes, but around 2 minutes, I'll give you outside of the door for your preparation. Okay. After 2 minutes, you'll enter through the door and start the case-wise total. I'll give you 14 minutes and 1 minute for your concise preparation. And 14 minutes after that, 4 minutes will be the examiner question-based discussion. According to your skill and performance, will be evaluated your score. So, Dr. Ashley, are you ready?
Yes.
So, in front of my table, there is a timer. So, I'm starting the timer, Dr. Aishwarya. Your timer start and 2 minutes for your preparation. Are you ready? Dr. Aishwarya, are you here?
Yes, we can start.
So, let's start.
Hello, I'm Dr. Joshi, one of the doctors in this clinic today. May I confirm your name and age, please?
Yes, doctor, I'm Osama and I'm 35-year-old.
Hello, thank you for being here. We're here to discuss about your medical problems and formulate a management plan. Is that fine?
It's okay, doctor.
I'll be asking you a few questions and examining you. Meanwhile, I'll make some notes which will remain confidential, but rest assured my focus is on you totally.
Sure, doctor.
Mr. Osama, please tell me what brings you to the clinic today?
Doctor, actually, I'm very much afraid for last 3 to 4 weeks, but I have a frequent sweaty of the hand, and I don't know why it causes. As I have to do type as a part-time job holder, but due to persisting this sweating of the hand, and it makes me very much anxious that why it ongoing, why?
Okay, I'm sorry about that, Mr. Osama. Can you please clarify if the sweating and anxiousness are indifferent from each other, or you are anxious because the sweating is occurring?
Actually, doctor, regarding the anxiousness, you can tell that actually I'm very much worried that why my hands are frequently sweating, even I can't type as it is my part-time job and I'm a student actually. And without it, I can't continue my study. So if that's the cause of this misconsciousness and anxiety, I think so.
I understand, Mr. Osama. Can you tell me if there is any other part of your body that you think sweats a lot?
No, doctor, I always think my hands always very much sweaty and waiting and my dress, my everything's I'm just consciously I'm sweeping it to reduce
Okay,
it.
okay. Thank you for telling me that. Is there any other problem that you're facing?
Like doctor,
Anything like headaches or feeling weak or having giddiness?
headache, doctor, yes, you can say it around last 2 months. Yes, I have this headache.
Okay, where exactly do you feel it?
It you can say all over my head, doctor.
Okay, did it start suddenly or slowly?
You can say it's gradually actually, but the severity you can tell it's much worsening nowadays. I don't know why.
I'm sorry about that. Do you think it increases when you cough, sneeze, or bend forward, anything like that?
No, doctor, I didn't notice it.
Anything relieves your headache?
Doctor, I try much for taking this NSAIDs, okay, my GP given me, but my GP also tried to give me relaxation, always giving me advice, but I don't feel good, doctor, actually.
I understand. Do you think you have problem with your vision?
No, doctor.
Any difficulty in your balance while standing or walking?
No, doctor, I didn't notice it.
How severe is your headache on a scale of 0 to 10?
Doctor, when it started 3 months ago, it's just, I think it's my new job that's the cause for my stress, could be the one of the cause. But nowadays, it would be like 7, sometimes 6, yes, sometimes 5 when I'm taking paracetamol.
Okay, thank you for telling that. Do you think you bump into doors or objects or walls, or when you drive, you're bumping around? Is that so?
I didn't feel like that.
All right. Any, all right. Do you have any tummy discomfort?
No, doctor.
Any loose motions?
No, doctor.
Any weakness in any part of the body?
No, doctor.
Okay. Any weight changes recently?
Weight changes, doctor. For being healthy, I always try to a good healthy diet. But I don't know why my shirt are losing. I don't know. But even I didn't measure it. But I think that it's losing.
Okay, you haven't measured it. But I consider it to be significant, isn't it? Because your clothes are loose.
You can say it could be a significant cause. Yes, it's a matter that my shirts, my pants are losing. Yes, it's a matter.
Okay, I'm sorry about that. Do you have any raised body temperature?
No, doctor, I didn't notice.
Any rashes or skin changes?
No, doctor.
Okay, any lumps, bumps in the body?
No, doctor.
Okay. Do you think you have night sweats, chills, especially in the night?
Sweating, doctor, you can say occasionally. I don't know why. Sometimes I feel sweating. Yes, you're right, but not at the night. But I feel sometimes, occasionally, I'm feeling sweaty.
Do you think you have to change your clothes or bed sheets because of this excess sweating?
No, doctor.
Okay, okay. All right. Can you tell me any change in appetite, increase or decrease?
I didn't notice. It's okay for me.
Any change in thirst?
Thirst, actually, when I'm sweating, one of my friend telling that I have to check my sugar level, but I don't know why. And occasionally I feel thirsty as well, but not so much. And always I check my glucose, but sometimes I feel that it could be higher, that sometimes I need to go more than usual in the toilet.
Okay, okay. You mean you have to go for passing your waterworks frequently?
Yes, rather than before, I think nowadays it's increased.
I understand. Uh, all right. Have you had any loss of consciousness ever?
No, doctor.
Any racing, pacing of your heart?
Racing, pacing of the heart. Yes, you can say that come and go like that. I think it could be due to the anxiety or stress related.
I
I
understand. Do
try
you have?
to calm down, but it's not relieving.
Okay, okay. Do you have any recent changes in your diet or exercise?
No, doctor.
Okay. Do you think it is difficult for you to get up from bed from sitting to standing?
No, doctor.
Okay. Is your sleep normal?
Yes,
All right. Thank you for telling me that. Any past medical history that I should know?
like doctor.
Diabetes, hypertension, or any thyroid problems, anything from childhood?
Not for childhood, doctor. For the last 3 months ago, my GP telling that my blood pressure is higher in range. And occasionally I need to visit due to my headache. Okay. And 3 months ago, he started Captopril 2.5 milligram. That's it.
Okay. Are you regular with that?
Yes, doctor.
Okay. Do you visit your GP for blood pressure monitoring regularly?
Yes, and he is very much frustrated. That's it's not imaginary. That's not controlling actually.
Okay, I understand that is disappointing. Any other medical problems that you must tell me?
No, doctor, not so significant.
Are you on any other medicines or OTC medicines or herbal medicines?
What is the OTC medicine, doctor?
Something that you buy directly from the pharmacist?
Paracetamol. That's it. And my GP given. That's it.
Okay, any medical problems in your family?
Like doctor?
Any problems with the kidneys or diabetes, hypertension in the family? High blood
Actually,
pressure?
doctor, my father passed away when only age of 50, and due to the cancer of the kidney. And it's so significant that we are very much anxious and we are very much concerned that the cause. We don't know why.
Oh, I'm very sorry for what your father had to face. Um, and when was this? How long has it been?
The age of my father was 50, but it was like 5 years ago.
Okay. Uh, any other family problems?
No, doctor.
Okay. Can I ask you a few personal questions?
Sure, doctor.
Do you drink?
So occasionally with my friends.
Okay. Do you smoke?
It is within limit.
Okay. Thank you for telling me that. Few more personal questions, please. Any party drugs that you use?
No, doctor.
Okay. Do you have a stable, intimate partner?
I'm not married yet, doctor.
Okay. Sorry for that question. Any casual partners if you might have had previously?
No, doctor, not like that.
Okay. What do you do for a living?
I said that I'm a student and I'm on the final part of my job, my study, and I'm doing part-time job as well.
I understand it must be difficult for you to carry this on. May I examine you now?
Yes, doctor, sure.
Okay. I want to look at her in the lying down position. I look for pallor icterus in the eyes.
No pallor, no icterus.
I want to see the mouth for any dehydration, macroglossia.
No.
I'll examine her visual field by perimetry, finger movement.
So you are checking the finger movement, right? H shape,
Not head shape, this perimetry, field of vision.
field of vision. Okay. So field of vision is normal.
Okay. All right. I'll look for head shape movement now.
It's okay, normal.
Okay. I'll look in the neck for thyromegaly.
So you are checking the thyromegaly. And what are the steps you want to do, doctor?
I'll see from a distance and then from behind I'll stabilize the thyroid gland and feel for both the lobes and then the isthmus. And I'll look below it also for the lower border. If the lower border extends below sternum, I'll percuss and see if there is retrosternal extension.
So according to your procedure and steps of the third examination, doctor, first of all, there is a no thyroid gland and so movable on swallowing, and there is a not palpable, and there is a no extension that you can measure or percuss. Anything else?
I'll ask to swallow a sip of water.
Yes, he can swallow, but there's no movement of any gland.
Okay, I'll ask her to stick out the tongue.
Okay, he can do so.
No, is there a movement from the neck swelling?
No,
Okay, so you mean there is no thyromegaly, no goiter is seen.
no.
Okay, I'll look for JVP quickly.
Okay, so jugular venous pressure is not detectable.
I'll look for S1, S2 in all four areas. Any murmurs, tachycardia.
S1, S2, all the area is normal, no murmur, no tachycardia, but the value of the heart rate outside as you measured.
Okay. I want to look for base of the lung auscultation.
After 2 minutes left. On
Okay.
auscultation, the base of the lung is normal.
I'll quickly look for the hands. Any tremor is there?
No tremor,
Okay. I want to see any nail changes, clubbing,
no clubbing, no nail changes.
any scars in the hand, any skin changes. Nodules?
No.
Okay. I'll just examine the abdomen. I want to palpate the kidneys.
Patient telling doctor, my right side there is some tenderness, kindly be gentle, and there's no mass.
Okay. So I'll check for tenderness in the renal angle.
No tenderness.
I'm hearing for the renal bruit.
No bruit.
Okay. I'll look for pedal edema.
There's no pedal edema, doctor.
Okay. Mr. Osama, can you please tell me if you had any burning waterworks lately?
No.
Okay. What are you concerned? I'm done examining you.
Doctor, could you tell me, is it a serious condition that I should know? What happened to me actually?
Okay, Mr. Osama, after talking to and examining you, I have a few things in my mind, but first of which we call pheochromocytoma. Do not worry about the medical term. It is a type of growth around your kidneys, and it might be responsible for the symptoms you're facing. There are other things. We will run you through some tests and identify what the reason could be.
Is it serious?
Mr. Osama, yes, it is a serious condition. A lot of people do recover from it. It might require
Your
surgery
time
in the
is up.
future.
Thank you. Just 1 minute for your consent and the clarification. Then we'll start the examiner question.
Okay.
So, doctor, could you tell me your positive finding in your cases?
Yes, this young adult with 2 months of headache and 1 month of increased sweating with a significant weight loss, night sweats, and polyuria, uh, dipsia with palpitations, known hypertensive, had probably tender, tenderness in the right lumbar area uh, with no tremors and tachycardia and hypertension. Uh, yes, these were my positive findings.
Okay. So, could you tell me, do you have differential or diagnosis?
Mm, I think I have two differentials over here. First one is going to be pheochromocytoma. Second one is going to be adrenal hyperplasia.
Anything else would you want to keep in your list?
Yes, this could be uncontrolled diabetes mellitus also.
Did you check or how you know it?
Yes, he has polyuria, polydipsia, and he does say that recently he had checked with his GP that the sugar was high.
Sugar was high. It's not like that, okay. But did you check or did you offer regarding the blood sugar level?
No, I didn't offer.
Okay. So, doctor, regarding the racing of the heartbeat, what do you think about it?
Uh, this could be due to tachycardia only due to increased catecholamine levels. Um,
Anything else do you want to add in your list?
for the racing pacing of the heart.
For the racing of the heart in generally, could it be any other cause, doctor?
It could be arrhythmia, but he did not have any significant clinical events to say so. It could be hyperthyroidism as well.
Doctor, could you tell me what are the investigation you want to do?
Yes, so investigate this patient. I'll do a complete hemogram and ESR to look for systemic inflammation or infection. LFT, RFT for systemic involvement. A urine routine dipstick to identify proteinuria, hematuria, glycosuria. I'll send a full thyroid profile. I'll send urinary catecholamides and serum catecholamine levels. I'll also want to see his HbA1c. I'll do an ECG, an echocardiogram. I'll also want to check his 8 a.m. serum cortisol level. Um,
What specific investigation you want to do for which you diagnosis?
I think it will be urinary free metanephrine levels.
Anything else?
Uh, okay. I'll also want to do a fundoscopy in this patient and a ultrasound abdomen followed by a contrast enhanced CT scan.
Is it specify your diagnosis? Apart
It is
from that, doctor, how you'll manage your patient?
right. At present, I want to admit him, control his blood pressure. If there is high blood sugar, then I want to control that as well. I'll give him beta blockers to control his anxiety and some analgesics for control of headache. Uh, then it will be directed by the diagnosis once it's detected.
Apart from beta blocker, is there any drugs do you want to consider according to your diagnosis?
Uh, yes, there are a set of drugs we would consider here, like phenoxybenzamine, phentolamine, nitroprusside. But I think beta blockers initially
Okay,
would reduce
your
symptoms.
time is up. Thank you, doctor.
Thank you.
Yes. So, Dr. Josie, your performance was really good. But we'll discuss regarding our mistakes. So, first of all, we are considering regarding your marking point. First, I want to start from the differential diagnosis. Okay. So, as you reach your diagnosis, as it is a pheochromocytoma, it's a very important to define other differential, and there is a 4 mark. So, 2 examiner will be there, and it is very important to satisfy both, because it's very important to carry maximum mark in long clinical consultation. So, differential diagnosis is very important. So, you should tell that it could be pheochromocytoma. Okay, it could be isolated. It could be von Hippel-Lindau, because there is a history of the early age, date of the patient's father,
Father.
and due to the renal cell carcinoma. You asked other point of view regarding the ataxia, balance problem, but you have to tell regarding the indifferential, regarding the man type 2A and 2B, and you have to ask regarding those questions as well, right, doctor?
Right.
Regarding the differential of the racing of the heartbeat is a very important to show them to be a safe doctor. So, arrhythmia, is it really, and bedside ECG along with the, if needed, 24-hour Holter monitoring, because you didn't ask or you missed the question regarding is it regular or irregular. What about the rhythm? Is there any time did they check the glucose level? What about that? Because the each question in communication skill is very important to rectify your performance. So, glucose level. Patients itself telling that I have to go through more than usual, but is it always, or is there any on and off, or is it persistently increasing or same? So, very important for the evaluation. Low glucose level 2, where you have to important for the differential. Regarding the hypoglycemia, it could be cause of the insulinoma, Dr. Josie. Okay, insulinoma, hypoglycemic attack, or any kind of the drug. You did the evaluation of the drug history, but it's very important to keep you differential point, Dr. Josie. Hypoglycemic attack could be insulinoma, but I didn't get any point to further reach the insulinoma, or any drug I didn't get any point. So you have to tell your examiner your every point, Dr. Josie. And you have to keep in this patient frequently from the first to last, telling doctor, I have anxiety, it's my new job, it's my part-time job, I am a typer, I'm a student, I'm in the final part thesis student. So you have to carry regarding the caffeine intake, anxiety, mood disturbance in your differential point, Dr. Joshi. Clear?
Yes.
Very important, you keep your differential point hyperthyroidism, it's okay, but you should keep in your differential point other as well, like acromegaly. So in differential point it is not so much satisfactory actually. I can keep here two only, okay, because there is a lots of thing that you have to ask and you have to clarify those matter as well. Clear, Dr. Joshi?
Yes.
Regarding the communication skill, patient is self talking, but in real exam, it is really true that patient never talk. It could be so much talkative, but not so significant talk. It's just two type patient. So important is that your duty to clarify each question to reach your diagnosis. So you missed as regarding the man type 2, like you asked abdominal discomfort simply, but you didn't ask any tummy pain. Discomfort doesn't simplify any pain. If you ask and during examination there is a tenderness, you have to ask how long this tenderness. Did he take any measurement for this pain? Because from the first he didn't evaluate or you didn't ask regarding the abdominal pain. It could be man type 2A hyperparathyroidism as well, right, Dr. Jose?
Okay.
So
Yes.
very important, you already asked regarding the any rush regarding the neurofibromatosis is okay, but von Hippel-Lindau syndrome, as it is a tumor, could be, it's a genetic testing, it's very important because there is a father issue, and regarding the from eye to balance problem, each of the organ, there is a tumor like growth in every part of the organ. So each question you ask regarding the eye examination to save it, but it's okay. But very important to tell the examiner, I want to do other examination. I have to take full examination along with that specific investigation. Because in your investigation, you didn't utter CT MRI of the abdomen and brain. You didn't utter events. So it's very important to utter. I have to do confirm my diagnosis through CT or MRI of the abdomen and brain. And genetic testing is very important to tell the examiner that I have to confirm by doing genetic testing. Dr. Josie, are you with me?
Yes.
So, Dr. Josie, regarding your investigation, I mean, in details, apart from differential and clinical communication and clinical judgment, according to the management, it's not so much I'm satisfied because surgical resection is very important, Dr. Josie, right?
Yes.
Surgical resection is very important. Very important. I have to actually ask regarding the preoperative management. What about the drugs? Like you told later, phencybenjamin alpha blocker, so beta blocker to reduce the anxiety or the racing of the heartbeat. Actually, as it is long clinical consultation, I always tell carry maximum mark to utter strongly, like non-pharmacological. Even if you can't utter, tell that I have to do education counseling, I have to reach my diagnosis, to doing the full investigation and examination. Regarding the pharmacological multidisciplinary team approach, I have to call the gland doctor, surgical doctor for the few chromocytoma if it is confirmed for the surgical resection. Dr. Josie, are you getting my point? So these
Yes.
are the point you have to utter each point because there is a mark. Clinical judgment, there is a 4 mark. I always tell there's a no, you cannot say next clinical will be what you don't know, even it could be not so much easy. I say that if you keep your differential nice way, like it could be anxiety, it could be von Hippel-Lindau, it could be man too, it's nice. But sometimes some judgment, some communication, sometimes could be hard. And so I have to carry maximum mark in long clinical case consultation, Dr. Josie. Okay. So here, physical examination and clinical judgment, and overall, it's not so much satisfactory, actually borderline. And regarding the welfare, it's okay, full mark, Dr. Josie. Clear. Around it will be around 20 this way, because borderline maximum, cause differential clinical judgment and investigation and communication. Communication, I cut maximum mark cause the question every point, acromegaly question, very important. Regarding the man type 2A, type 2B, you have to specify your diagnosis or differential base. What is your differential, Dr. Josie? What were you kept in the outside? Tell me, Dr. Josie, in your differential point when you see this picture, what was your
Because
differential?
the presenting was increased sweating, I was thinking about hyperglycemia and hypoglycemia, hyperthyroidism, pheochromocytoma, anxiety disorder because young person.
Okay. Pheochromocytoma, anxiety disorder, but you didn't enter anxiety disorder, right? So you can say to save your marks. Even though, Dr. Josie, even though you can't reach, but tell what you written. Even though say this way, sir, I excluded this one, I excluded man two this way, okay? Vulnerable
Okay.
window here, visual disturbance. You even you have asked the abdominal regarding the gait disturbance, other any kind of the change of the water work. You ask the amount of the food urine, but you have to ask why you ask this question because there is a history. So I want to clarify, is there any chance of the vulnerable? But I have to do genetic testing, right, Doctor Josie? I have to do
Yeah.
genetic testing, yes. So math have 2A, 2B questions. If you ask concisely, it will be so nice in your presentation. What are the questions you are asking? This is so nice that I am asking hypoglycemia question. Did you check any time? Did you take any time any orange juice? Did you feel any time good? You have to pass the more urine. How long? Is it progressively increasing or is it same? Like Dr. Josie, you have to ask all throughout the question. How long you started? Is there any medication you are taking? Okay. But if you ask a vague question like, do you have any past medical history? Are specify like what? Any medical emergency? Any admission, any kind of the previous history of the diabetes, hypertension. I myself tell or the patients myself telling that yes, I have a high blood pressure, but you have to ask, right, doctor? So these are the differential point, and these are the very important to utter. Thank you, Dr. Josie. So
Thank you,
in
sir.
this case, the differential pheochromocytoma, it could be isolated, it could be vulnerable window, man type 2A, 2B, neurofibromatosis and hypoglycemic attack along with the anxiety. Very important to ask regarding the acromegaly features as well. Though there is a telling there is a weight loss, fine, but very important to ask other questions like visual disturbance. Dr. Josie nicely uttered and evaluate even in examination. She did it nicely. All the part of the visual examination and the other examination. Very important to telling that as it is long clinical consultation, that doesn't mean I'm getting more time and I can do everything. Actually, in the stress in the real exam is very important to do most important thing like blood pressure. Can I do it right now, sir? If it is same like outside, okay, fine, I know I have to utter or I have to memorize what was that. In stress, sometimes we forget what was the outside. Pulse, is it same like now or I have to count it because it's a 15 second. If you count and multiply by 4, mean it will take 15 second already. If examiner tell you that okay, do it, so mean you have to do it right now. So for being a good, a safe doctor uttering mind, I have to complete my throughout the examination and investigation to reach my summaries that even by getting, if you summarize your point, I appreciate your concern. What is your full examination and blood test, heart test is very important to confirm my diagnosis. It could be pheochromocytoma, but I have other list as well. I have to confirm them via doing my investigation. So these are the way to diagnosis. Regarding the management concern, as same way pharmacological and non-pharmacological investigation, CT, MRI of the abdomen and brain, genetic test is very important to specify. Initially, if you are a long time, like it's a Dr. Josie did, like HB1C, thyroid function test, there is a clue, obviously, there is a sugar level high, but Dr. Josie, you means that doctors might wrong information or information which didn't give, even you can write it in your sitting, you can write, but don't utter wrong, like the patients, the Osama didn't confirm by the GP high sugar, the friend telling you do sugar level or do the test and she did it and there is a glucose level high. That was the point, because if you utter any wrong word, it will be completely shut down your mark. So best to be safe. No need to utter any which is you're not sure about it. Okay. Yes, Dr. Ahmed. So as I said, this way, presentation and be confident and do write. If you need to write, you can write some words, which is very important, or you may forget even in the front of the examiner, you can tell them. Okay. So regarding the pheochromocytoma, we know very well, but very important to utter the presentation, because sometimes examiner question is very important. What will be the features? But which hormone, adrenaline, non-adrenaline, catecholamine, which is the triggering factor? Is there any orthostatic hypertension? You can tell I can do it. Orthostatic hypertension is present or not. Visual problem, visual field of vision. Why? Due to the hypertensive, right, patient? So that we can do it. So visual field or visual perimetry. Regarding the von Hippel-Lindau syndrome, it is all over the gland, like cerebellum, retina, all over the gland. There is a C. So according to the ataxia, there is a balance problem. All will be the features of the von Hippel-Lindau syndrome. So very important to specify investigation, management, and your point. So you have to utter these are the findings. So most probable my diagnosis is pheochromocytoma, could be anxiety, could be related to the man type 2A. I have to do the catecholamine, I have to do the MRI of the abdomen or CT scan of the abdomen to reach my diagnosis. And other than this, we can do the parathyroid level and serum calcium phosphate level as well to exclude my differential point. I hope any question from anyone. Open discussion.
Ma'am, can you share the von Hippel-Lindau syndrome slide?
Sure. From any side, any question, any concern, anyone.
Madam, hello.
Yes. Yes.
How we can ask a question of man 2B?
Man 2B, actually, there is a marfanoid habitus and neurofibromatosis. Dr. Joseph nicely asked, is there any rash? If I said, yes, I have a rash, so you have to show it. Like, can you show me this? Then if it is a fibroma, like, right, doctor? So you can see it. Or regarding the marfanoid habitus, any changes, right? Height, structure, body weight, is it any abnormality did you find out? Apart from that, if you find out man type 2B, there is a pheochromocytoma one of the part, there is a medullary thyroid carcinoma one of the part, right? So it is the excluding method. Dr. Joshi nicely asked, there is any racing of the heartbeat. I said yes, there is any kind of the high blood pressure, but Dr. Joshi missed the hyperthyroid question. Any cold intolerance, hot intolerance, any eye blurring of the vision, any discomfort, lots of question, like, but the loose motion she asked, but some question concisely along with this disease base you have to ask, like hypercalcemia question, any polyuria, I mean you have to go more water work, any loose motion. Dr. Joshi asked regarding the hyperthyroid status. This way, concisely each question you have to ask, doctor. I hope you are getting my point.
Thank you so much, madam. Thank you.
From the child asking why not thyrotoxicosis. I said it is one of the differential, but if Dr. Joshi asks me other symptoms like any hot intolerance, any kind of the eye problem like Graves' ophthalmopathy, any loose motion, I always, all the question few asked by Dr. Joshi, but I said all are no. So there is a no significant, but due to the heart pressing, Dr. Joshi confirmed that I have to third function test to reach my diagnosis. So this is the point that how I can be a safe to be examiner.
Madam, one thing more.
Sure.
If we cannot reach to the diagnosis in our
Sure.
Consultations, can we explain that sir, I have ruled out this by asking?
Yes, obviously, this is the pattern for being a good doctor, for carrying more mark. Even if you can't reach, it's not a matter, because we don't have investigation findings. So tell One tool is priority based, like Dr. Joshi said, few chromocytoma, but others like hyperthyroidism, anxiety, MANTAP2A, and tell the examiner, sir, I have to do this, and I have to reach my. It's a very excellent in passes. No one tells this is the confirm. No one, never possible. I am taking examination, I'm taking the history, that's it. That doesn't mean I reach my diagnosis. Is it possible? So in passes, long clinical consultation, tell if you have a list, or you can write in front. There's a page also, so you can write your DD and you can tell these are my DD topmost, and second, third, fourth, and this investigation, doctor. I hope you clear.
Thank you, ma'am.
So thank you all, and hoping all enjoyed our classes, and I'm ending our session. Assalamu alaikum to all.
Thank you, Doctor.
Thank you, madam. Thank you.